Hi, I'm Dr. Genevieve Milnes from Psychology Australia. In this session, I will be talking about eating disorders. There are two major eating disorders that I will refer to here: anorexia nervosa and bulimia nervosa. The first is anorexia nervosa, which is characterised by a refusal to maintain a normal body weight. Persons with this condition have a fear of gaining weight, and when they look at themselves and their own bodies, they see a distorted image, one that is not pleasing to them. They perceive themselves to be large and out of shape and feel uncomfortable about their bodies. Individuals with this disorder refuse to maintain a normal body weight. They show intense fear of gaining weight, and they perceive themselves as being different to what they actually are. They maintain a very low body weight, and as they physically develop, they fail to make appropriate gains. If an individual weighs less than 85% of the normal weight for a person's height and age, then that person has met the first of 4 criteria for anorexia nervosa, according to the Diagnostic and Statistical Manual of Mental Disorders. The second criterion is an intense fear of gaining weight. The third criterion concerns how the individual sees themselves. People with an eating disorder see themselves as being fat and overweight. For women, there is another criterion, that is, the cessation of monthly periods, a loss of menstrual bleeding medically called amenorrhea. So the 4 criteria are weighing less than 85% of your normal weight, being intensely afraid of gaining weight, seeing yourself as fat or overweight, and for women, loss of your monthly period for at least 3 months. Anorexia nervosa appears more in westernized countries where attractiveness and thinness are associated. Over 90% of people with anorexia are females. Of late, anorexia has increased in the population. It usually begins between the ages of 14 and 18, and it may accompany a stressful event. Hospitalisation may be necessary to re-establish fluids and electrolyte imbalances. Death can result from starvation, suicide, or the imbalance of electrolytes. The second major eating disorder is bulimia nervosa, which is characterised by repeated binge eating episodes, followed by induced vomiting, fasting, excessive exercise, or a misuse of laxatives to compensate for the food intake. People with bulimia nervosa also show a disturbed perception in the shape and size of their own body, seeing themselves as gross or fat and overweight. Individuals with bulimia experience episodes of binge eating of food in larger quantities than most people would eat in the same period of time, accompanied by a lack of control over what or how much is being eaten. After eating these huge amounts of food, the individual tries to get rid of the food by vomiting, misuse of laxatives, fasting, using excessive exercise to prevent gaining weight from the food eaten. If this behaviour happens, on average, twice a week for 3 months, then the individual is said to have satisfied one of the criterion for the diagnosis. There is a 4th criterion of being aware of one's own body and seeing oneself as misshapen and overweight. And 5thly, ensuring that this disturbance doesn't belong to anorexia nervosa. So the 5 criteria are: 1. Eating large amounts of food with no control. 2. Getting rid of that food as quickly as possible by abusing the body. 3. Engaging in this behaviour at least twice a week. 4. Seeing yourself as overweight and misshapen. And 5. Distinguishing between bulimia and anorexia, as only one condition can be present at one time. Individuals with bulimia nervosa are normally within the average weight range. Between binges, these individuals restrict themselves to diet foods, There are two types, the purging type and the non-purging type, who use other methods to rid themselves of the foods they have just eaten. Mood disorders are common in these individuals and self-esteem is low. The frequent vomiting leads to a permanent loss of dental enamel and teeth may appear chipped. Bulimia nervosa appears in most westernised countries. At least 90% are female. It usually begins in late adolescence and frequently after an episode of dieting. If you think you or someone you care about may be suffering from an eating disorder, then I recommend you have a chat with a psychologist because professional help is available. Thank you for listening. Remember, there's lots of free, helpful information and online tests for eating disorders and other conditions on the Psychology Australia website.